So we will say the formal welcome later at 5:30.
Okay, so we're live. I'm Professor Angus.
We'll do the formal welcome. At the moment, people would be joining in, so we will do the formal welcome at 5:30 to people. But we're just trying to set up. But thank you very much for taking time out. I know you're very busy on this weekend, but I really appreciate that you joined in.
It's okay. It's quite intriguing, Suhail, to have you in London, me in Nottingham, and our guests all over the world.
Yeah,
8 different countries.
8 different countries now. This shows the eagerness and the transformation of the practices, how medical practices have now changed. I mean, imagine, Prof, when I was doing my registrarship, when you were, you were. I think you were a professor in Nottingham University when I was a registrar.
Yeah. 1 minute. I had noises in the background I had to deal with.
That's fine. That's all right.
So we've got 10 minutes to go before we formally start. Is that right?
Yes, about 12 minutes. Yeah. So I remember those times when it's showing the network quality poor. Let me just check if my son is not playing video game. Just allow me a second. He could be. He could well be. So, Prof, the transformation is amazing. I remember at that time, the maximum telemedicine we could ever think of was somebody calling and we giving advice on telephone.
Yeah.
And
believe it or not, when we had the beginning of the coronavirus crisis here in the UK, the GPs started to do that, and the whole of their practice moved almost overnight onto telephone consultations. And that was a big change for GPs because they hadn't done terribly much telemedicine previously. And then they realized that in order for them to be safe, they were safer not having the patient in front of them, but they just used the telephone. And it's only as things have progressed since February that we've seen the use of video conferencing in general practice in the UK.
Yeah, well, I mean, I think the way things have transformed, they were the need of the changing practices. Doctors were more and more required, and the patient's demand went up and up.
Yeah.
Patient's demand went up. They wanted doctor quicker, and they wanted the same doctor which could have traveled maybe outside the town, and they was kind of more linked and more closely working with the doctor than before. Before there was doctor was just kind of could be any doctor, but then they started developing choices. No, I want my doctor.
Yeah. Well, I think the whole scene in relation to providing care, medical care, is changing, both in this country, in the UK, and all over the world.
But have you not noticed that this is in sync with the technological development? Like the cameras are getting better, the mobile phones have got high resolution cameras, the processors are getting strong, the RAM is increasing, internet bandwidth is going up. All this is moving together in sync.
Yes, I still remember when I started using computers when we were using the telephone line for our computer links, and that was very tedious before we had broadband.
And I think I also remember that the news did not used to travel very much quickly. That if some hospital is doing something very innovative, it took a long time for that to come out.
Yeah. I think there are disadvantages, though, because we are seeing people who are publicizing their untested ways of managing patients rather too much. And I think that can be an issue on the web. Somebody who is enthusiastic and perhaps hasn't fully evaluated the treatment they're doing are showing the treatment publicly before it's properly evaluated, and that can be dangerous.
Yeah, and at the same time, the telemedicine has advantage of having a lot of colleagues connecting to each other now. If I'm seeing a patient on telemedicine, I can easily invite you from a distance in that conversation. I can refer you a patient from a distance without having to send the patient physically to you. So there is a lot of facilitation, the new model of treatment planning has come up now.
Yes, it is, and it's different, and it's going to be different once coronavirus is under control, because having made the change, people have realized some of the things that they were doing in the past are now archaic, and there are more efficient and better ways of doing things.
Yeah. I think this is eventually, I don't believe after Corona, telemedicine will go away. With that eagerness of telemedicine will fade. I think it's going to go up because people have now seen it. People have seen the dimension.
Right. I've got a message from Mohammed Javed saying he's trying to sign in and cannot do so.
I think we have an administrator who's taking up all these queries.
Lovely.
Suhail has kindly been doing endless work since yesterday morning, and he's answering queries. So I'm sure Suhail will pick up this quickly.
It is Suhail that's emailed.
Yeah, I think if somebody is having a problem on the connection signing in, if they can either email Zohaib. Zohaib is the person to take up all the messages, and I think it's the same email address which was used to send invitations to you, to all of you, if you're listening.
Oh, hold on. Let me get Suhaib on the phone. Can I?
No, but Prof, they're handling it.
Okay, you're dealing with it. Right.
Zohaib is very much involved. He's actually in this conversation as a guest, and I'm sure he's also watching this. And I think we have a team, quite a team, who is looking after this. I'm just messaging Zohaib to take care of all the matters, just as I think he's doing it, and he just sent a message. Yes, I'm on it. Yeah. So we're just giving him a 4-minute call now for going live. 4 minutes to live.
So now is a good time in Pakistan because the fasting that some have had to endure is over now.
Yes, I think people have recovered after the lethargy they faced after opening the fast, and then they're alert, and they will also be praying later on tonight. And they have, I think it's a good time overall. And at this point, especially, we are going to talk about something they are already using, or they're starting to use. Yeah, I'm just messaging Zohaib.
It is interesting that you were able to listen to us on the Zoom platform and inadvertently.
Oh yes.
I hadn't realized that.
No, that's fine.
I was getting you to
yes. Yes.
text through and say, I can hear you.
Yeah. You know, I just thought it might be important, but so Prof, just 2 minutes before we go live, and we are live, but we're just going to start in 2 minutes time. And just keep your first slide ready. I'm going to ask you to share that as we start.
Yeah.
One minute, Prof. Thirty seconds. Ten seconds. Five, 4, 3, 2, 1. We welcome everybody who has a course which has been set up by University of Health Sciences. I welcome all the participants who have joined in from various countries, and they are actually, I can see the logins filling up, and hopefully we have to people who join late, they can catch up later on the recording, but we like to have you live with us during this lecture. So the purpose of the telemedicine education is to keep you updated with the changing practices of medicine. Telemedicine is not an additional modality. It is the way medicine is going to be practiced in many areas in future. So learning it now is quite handy. Otherwise, learning under stress might be compromised. I'm Suhail Chughtai. I'm an orthopedic surgeon based in London. I have been Microsoft certified specialist since 2001. And along with that, I have spent around 15 years in telemedicine and telehealth, designing certificates, courses, softwares, and more than 20 international projects have been designed. I'm thankful to Professor Javed Akram, the Vice Chancellor, who has initiated this very brilliant idea to have telemedicine education, and Dr. Saqib Mahmood, and Dr. Saima Chaudhry, Dr. Asad Zahir from the leaders from University of Health Sciences, supported by Mr. Faisal Amin, the IT director, and also Zuhaib Aslam, who is monitoring and doing the admin responsibility of this webinar. Thank you very much, team, for supporting us. Let me welcome Professor Angus Wallace. Professor, welcome to the evening.
Hi, Suhail. I thought it would be helpful for you to know a little bit about my own background. I'm a retired consultant orthopedic.
So why don't you put up your first slide and then you can do that. I'll just take the slide off and then you can put up your first slide while you're introducing yourself. I can share your slides and then we shall take you live on the slides. Then you can introduce. Yeah, I got you there.
We're there.
Yes, Prof, go ahead.
My background is as an orthopedic surgeon and professor in the UK, but in the year 2000, I set up the Faculty of Health Informatics at the Royal College of Surgeons of Edinburgh, where I was the Dean of the faculty for 5 years. And I'm now very much involved with the new Faculty of Clinical Informatics in the UK that started in 2017. I am the chair of the Conference Planning Committee for the Faculty of Clinical Informatics in the UK, and we have a big scientific conference on the 8th of October in London. So we are going to be talking about telehealth, and it's quite important for people to understand what telehealth and telemedicine is. Tele comes from the Greek, where it has the meaning of far, and it's usually attached to words, meaning that tele from afar, reaching over a distance, and therefore this leads to telehealth, which is the remote diagnosis and treatment of patients nowadays, usually using telecommunications technology. There are many types of telehealth, a type where you use store and forwards, a type where you have remote monitoring, and a type where you have a real-time interactive service where you're talking to the patients on the internet. Each of these has a beneficial role to play in overall healthcare, and we are seeing now increasing tangible benefits of doing this for both healthcare workers and for patients. And this has been stimulated by the corona crisis that we have all experienced. So let me talk a little bit about store and forwards, mobile telecare. This type of telecare overcomes the need for the patient to meet in person with the medical practitioner. Instead, their data, and this may be pictures, for instance, if they have a skin rash, or it may be an ECG that they have had taken at a centre that can be transmitted to a central base and a diagnosis made that way. The medical team will study the information coming in, provide a diagnosis, and may email or communicate the interpretation of the information back to the patient without having a face-to-face doctor-patient or nurse-patient meeting. It's become particularly common in the UK for dermatology and also radiology and pathology are following in the footsteps, and indeed ophthalmology, where people are attending their optician, having pictures of their retina taken and sent to the ophthalmologist. Now, remote telecare is slightly different. Here you are self-monitoring or self-testing. You're using technological devices, and I know Suhail will talk about some of these later. They monitor your health, and the information is transmitted centrally for observation It's extensively used for things like cardiovascular disease, diabetes, and asthma. And it's very cost effective, resulting in more frequent measurements being taken and these being transmitted to the medical and nursing carers almost immediately, and they can, from this information, help with the overall management of the patient. There are some risks to tests conducted by the patient themselves. They may be inaccurate. However, in general, patients learn very quickly how to do things properly, and the outcomes are thought to be similar to those provided with a direct medical input. Telemedicine services are the services that I have been most associated with over the last 10 years. They're interactive services where you can provide immediate advice to patients who may require medical attention. You can do this either by a phone call, online. You can do it with home visits on the internet. A medical history and consultation about presenting symptoms can be undertaken remotely, and we are learning tricks about how we do that. And this can be followed up by an assessment similar to those usually conducted with face-to-face appointments. Now, there are good examples of real-time telemedicine services that have been set up and are working. And this is outside my own specialty of orthopedics. For tele-neuropsychology, this is an example of the way telemedicine can be used. The neuropsychological consultation and assessment can be done over the phone, or they can be done on a video consultation. Standard evaluation techniques are used to assess the patient using video technology. And a study from 2018 found that this method provides a feasible and reliable alternative to traditional in-person consultations for the elderly. Now, these are not young people, these are elderly people, not always totally with it, who are able to communicate with their medical advisors using this technology, and it works. Telepharmacy is proving to be more and more popular because it means patients can get advice from their pharmacist without going to the pharmacy. The service allows medications to be monitored carefully, and patients can be offered advice over the phone or on video. And depending on national regulations, refill authorization for repeat prescriptions can be provided using these methods. Now, we're really interested in seeing the development of the video teleconference platforms and how they become telemedicine suites. And it really started with the popularity of Skype as a communication model, FaceTime, which Apple developed, and then the more sophisticated WebEx was developed, but it was quite complicated when it was brought in. MS Teams that we're using today is a more usable system. GoToMeeting works reasonably well. Personally, I don't think it's as good as MS Teams, but the platform that has hit the headlines in the UK is Zoom, mainly because our government at 5 o'clock every evening has a meeting on the BBC TV using Zoom technology. Medical City Online, which is Suhail's company, have developed their own telemedicine platforms, which have been used for the coronavirus advice in Pakistan, and that platform has been very successful. Now, I'm not going to let you hear the sound, but this is one of my early telemedicine video conferences, and I am consulting with a lady who's 50 miles away. You won't be hearing any sound from her. I'll talk through it. Her family doctor is behind, and we are assessing her right shoulder. And I've developed techniques of doing the shoulder assessment with either a nurse or the family doctor. This lady has a large or massive rotator cuff tear, and she's unable to lift her right arm properly. So the doctor was demonstrating resisted abduction, outward push, but then we've used a trick. We've got a litre of milk in a 2-litre canister, and she's going to try and lift it. And if you watch, she shrugs her shoulder as she tries to lift the litre of milk. And that is a typical sign of somebody who has a rotator cuff tear. And I'm able, bottom right, to demonstrate to this lady who is 50 miles away the problems that she has with her shoulder. And I'm able to demonstrate on her x-rays where her rotator cuff problem is. So we're going to see now an x-ray of her shoulder from my television screen transmitted to her, and that x-ray shows the humeral head, the ball of the shoulder joint, which has moved upwards and is no longer lined up with the socket, and that is because the tendon at the top of the shoulder has become torn. And I'm able to show on the MRI scan that she obtained prior to this consultation where the torn tendon is and where the high humeral head is. So that's what you're able to do with a telemedicine communication, with a video conference. I made an assessment of this lady, and based on that assessment, I placed her on my waiting list. I did see her for a face-to-face consultation 2 weeks before her operation, when she had blood tests done, and we made sure she was fit for surgery. So that is what is achievable nowadays using the sort of technology that we are associated with. And we're now I'm going to hand over to Suhail, who's going to take over and demonstrate what he has achieved. So Suhail, I think I've given you the screen back.
Thank you, Prof. I appreciate. I'm getting some echo, Prof, from your side. Can you mute your mic?
I can.
Yeah. So this is what. Thank you, Prof, for very good overview of the history of telemedicine. At the same time, you have taken us through a practical example of what you have done yourself, hands-on, in terms of seeing a patient from a distance. I remember I was a registrar at the time, and I think things were being talked about, but mostly on telephones at that time. And then video was brought in much, much later. But right now, 90% of telemedicine consultations, they use the live video. So we're going to talk about live video as an almost essential part of telemedicine. I must emphasize one thing here, that telemedicine is not video conferencing. Video conferencing is part of telemedicine. And in one of my lectures in future, next week perhaps, we will be talking about how telemedicine software is different from a video conferencing software. So today, if I may just share my screen, I'm just going to do that now. And what you see on the screen now is the topic of my presentation, setting up a telemedicine practice. How do we set up a telemedicine practice? And this is what I'm going to take you through. So again, as I mentioned, that my telemedicine, telehealth has been a significant part of my work, besides my clinical work, for the last 15-20 years. especially for the last 10 years, it has been very intense, where I've been developing software and helping many hospitals at government levels as well to get telemedicine, help their healthcare system. What telemedicine does is it will equalize the physician density in an area where doctors are not segregated equally, like more doctors in cities, less doctors in villages. Doctors are not keen to go to villages. We can still send them through telemedicine services, like providing a specialist care in a basic health unit in Pakistan setting. I will be talking more about that later. But let me take you to the idea. So let's say if you are the one, imagine yourself here, you are a doctor who wants to start telemedicine. All my next few slides, kindly imagine that it's about you. It's about you starting telemedicine practice. So this is what you need. First of all, let's talk about what is the computer hardware you would require to set up your telemedicine practice. It's about your practice now. So first of all, you would need a desktop. You have to choose. Do you want to do desktop or laptop? Now you can switch between the two seamlessly because the software, most of the softwares nowadays should be cloud-based, which means you don't have to download a particular file on a computer. You can just open browser from anywhere. It doesn't have to be even your computer. So let's say you choose between a desktop and a laptop, and the choice is merely convenience-based. Or it could be that you do only telemedicine from home. Then if that is the case, then I would like you to consider desktop as a preferred option, because desktops are much more sturdier system. They've got a better heat sink system. They're more expandable. They're more power supply managers. They manage the power supply in a much better way than the laptops do. Then their screen can be bigger. You're not confined to a small laptop screen. You can have much more attachments to a desktop. So my choice, if I want to do telemedicine from a fixed base, would be a desktop computer. Then of course, laptop has its own advantages. For example, if the electricity is shut down for some reason, laptop's own battery will give you a backup. So laptop is portable. Let's say there's a bit of noise, my kids are playing here, I can take my laptop to the next room. So laptops have advantages. So it's merely your choice. Laptops can be equally powerful as desktops. So the operating system, Windows or Mac, telemedicine is blind to that. Telemedicine does not see whether you use Windows or you use any other operating system. Basically, Mac, Windows, it doesn't matter. What matters is the browser. Which browser you use, because there are many software, telemedicine software, which do not like Safari. So they like Chrome. So the browser is the important choice, not the operating system. But let me show you one thing here, very important, that you basically want to choose, if you've got Windows, what are your choices? Windows 7, 8.1 or 10? Then in the MacBook, you've got many choices as well. So what I recommend is the minimum you need is Windows 10. Why not 7? Because 7 has been stopped by Windows, by Microsoft even. Microsoft is not supporting 7 anymore. And Windows 8 is meant for touchscreens mainly. Windows 8 was made for touchscreen, then it had a glitch, then they made 8.1. So if you want to use a touchscreen, which I will talk about that later, Windows 10 is your choice for minimum, and then Mac, for a Mac, 10.12. I will recommend that you go for 10.14 if you want to use Apple Mac. I think if you bought your Apple Mac in the last 2 years, it will be 13 or 14 anyway. So what is the processor choice now? Now you're collecting your equipment, you're buying equipment, or you're going to upgrade your equipment, or you just want to know, is my equipment good enough? The processors can be single core, can be multi-core, it can be single core, can be multi-core, and then what matters is what generation is the processor. You can say I've got i7. But if that i7 is generation 3, then the i3 of the current time will be faster than the i7 of 5 years ago because of the generation type. So single core processors, what is a single core? It can process single set of instructions at one time. Now you can imagine that it will be slower, whereas a multi-core can process 2 sets or more at the same time. Now when you do video conferencing and you're pulling patients' medical records, that is 2 sets of instructions. So a multi-core processor will wake up the second core when required. And that is the benefit of single core, multi-core. That multi-core will have a reserve force available for you when you want to pull patients' records while you're talking to patient. That is 2 sets of instructions. The multi-core processor will wake up and will bring the second instruction. It'll be quite fast. So if you're choosing between one, go for ask your computer specialist to give you a multi-core processor. And then always go for generation of processors. Before you go into generation, just take a look. 1.3 gigahertz processor is 1.3 billion times per second speed. This is the level of instructions they're passing. So that means changing from 1.3 to 1.4 is a big change. Now, I would recommend you to have at least 1.3 gigahertz. This means that if you have i3, 5 years old, you are still okay. You can still do telemedicine. If you got i3, which is 5 to 6 years old, that is 3rd generation. But I would recommend you to have 2.4 gigahertz. That means i3, which is about 3 years old, or i5, which is about 5 years old. So go for the processor which has 2.5 gigahertz as the basic speed. This is now commonly available. You don't have to even spend a lot of money for that. 2.4 gigahertz, I would suggest you go. Now, why generation? This is the history of the processors. 1st generation, 2nd generation. You can see the generation starts from 2010, and then it went up all the way. In 2019, we have 10th generation processor. So if someone is giving you an i7, do ask what is the generation, because i7 of old generation which much slower than i3 of a new generation. So please ask for the generation, not just processor speed. Now, how much generation makes a difference? The battery life between a 3rd generation and 4th generation, there's a 3 hours difference. 3 hours difference. There is much more efficient use of battery for a laptop if you switch only 1 generation. And that is a lot of difference. Then the graphics performance. How would the screen appear on your laptop or your desktop? From a 3rd generation, you can see the quicker screen refresh is possible when you go from 2nd to 4th generation. You can see the climb from 20 times to 80 times climb for a screen graphics display. So I would suggest you to ask for the generation of the processor, not just the speed. So I would recommend minimum 3rd generation. You're okay, but please go for 6th generation if you're investing into a new technology or new laptop. Now, this is a slide I love to present. Your desktop can virtually fly if you have a multi-core latest generation. You're sitting on a rocket. You're sitting on a jumbo jet, because multi-core starts with 1.8 gigahertz at basic speed. That means 1.8 gigahertz is half a nanosecond. Half a nanosecond processing speed means the light can only travel 6 inches before your processor can make a calculation. That is the speed we are talking if you have 1.8 gigahertz processor at your desktop. So now the most important point of all this technical discussion, if you forget everything, just remember one thing: RAM. Let's say you've forgotten all the lecture today, but you've remembered this slide. I think you still remember a lot. RAM. Invest in RAM. If you don't want to change your computer, don't want to do anything, think of RAM. Now, what is RAM? RAM is random access memory. Random access. Let me take my pen here. It's random access memory. And that stores the data for short-term use. It provides quick access to the files that the computer is actively reading, like patient's medical records. RAM is quicker than running the same data directly off a hard drive. CPU has to work much harder if the RAM is low. You will start hearing funny noises from your computer if you're working and struggling with a low RAM of 2 GB. So try and get RAM. RAM is like oxygen to the computer, if I can describe this way. And then random access memory really helps high demand software like telemedicine. And that is the key. I would recommend minimum 2 GB. Please do not do telemedicine with less than 2 GB RAM computer, but start with 4 GB something. I think most of the laptops now are 4 GB RAM. So you're pretty okay if you have got laptop which you bought 2-3 years ago. Now, next thing is graphics card. That's again important, not critical, but important. The graphics card has a RAM, their own RAM called video RAM. That should be at least half the size of the computer system RAM. For example, if your system had 4 GB RAM, your graphics card should have 2 GB video RAM. That means faster performance by drawing complex MRI scan, ECG. If you're drawing it on the screen, if it's appearing on the screen, that's a very complex picture, MRI scan. It'll draw it very quickly. It's like computer will take it as a game, that someone is playing a game, video game, and they want a quick redraw. High video RAM is useful for textures, graphics, complex images like MRI scan. So I would recommend 0.5 GB video RAM minimum, but 2 GB I recommend for you to have, to really, if you want to enjoy telemedicine. So hard drive. Well, hard drive is, I think, the more the space, the better it is. But why do you need space? You need space because there's a thing called as computer swap file, which means that the computer wants a breathing space for doing complex procedures. If the RAM is falling short, hard disk gives some help to the RAM. So computer needs a swap file. That swap file is temporary space created on the hard drive to assist the complex procedures. Now, if there's no space, the process will become very slow. So you need at least 20 GB on your system. And I would recommend minimum 5 GB space, free. That is free space, not the 5 GB capacity, 5 GB free space on your system. And at least 20 is better, because then Windows will breathe and will give you a very fast speed. So monitor, does it matter which monitor you use? I think today this lecture is about doctors doing telemedicine. We're not talking about the patient's perspective. Patients can go on a mobile phone because they're on the listening end, whereas doctor is at the executing end. So at the executing end, you really need a good size screen. A good size screen, what is that? 12 inches is proven to be the minimum screen for a doctor. Please remember that. You cannot do telemedicine using your mobile phone as a doctor. Patient can do telemedicine as your patient, but patient is not giving you instructions. You are giving instructions. So you're better off using minimum 12-inch screen, but I recommend 15-inch screen because you want to detail, you want to see the ECG squares, you want to see the MRI scan, this interspinal intervals. So you want to see this detailed image. So 15-inch screen is minimum, I recommend, although you can get away with 12-inch screen. So this was, by the way, these are all the features you need on the computer. So that is now about you setting up your computer space. Now you got things set up, everything is available, but what about the attachments which you require now to start with telemedicine? So what are those attachments? Let's go there. Of course, you need a webcam because we talked about video conferencing. Video conferencing is part of telemedicine. So webcam. You need when you buy a webcam, please ask, what is the frame rate? 30 frames per second? That is, in fact, you don't have to even ask. Most of the webcams in the last 3 years are manufactured minimum 30 frames per second. Resolution. In the last 2 years, 720 pixel is minimum, but you can go up to 180 if you want a clarity. 4K webcams are available. I'm not using one today, I will switch maybe towards the end of the conference. We lecture today on a 4K webcam, and you will see the difference. You will see the difference if your monitor is 4K compatible. So 4K is only worth investing if you feel that your listeners are using 4K. Otherwise, it's only for you will look good on your screen, but your listeners or your viewers may not see that difference. So HD 720 pixel 1080 is good enough. Angle of view. Right now, I'm using a short angle webcam. You can see my width is this much, but later on I'll shift to a wide angle and you will see it's going to go fairly wide. Now that is important if you're planning to move a lot backward, especially for a physiotherapist. It could be important, but for a speech therapist, for an endocrinologist, for other people, a narrow angle is fine. For an orthopedic surgeon where you want to show how to bend the knee, how to bend forward, backwards, you may require a wide angle. But for a person who's going to sit and talk to the patient, narrow angle or standard angle is fine. Focus capability, autofocus. If you move your hand in front, it'll focus the hand. That is again available. If you expect to move much like a physiotherapist, want to show exercises, better have the fast focus capability. Microphone. Now, I'm not using an extra microphone. I'm using microphone off my webcam. But if I want to make the sound even better, I could have used a separate microphone, for example, like this one, which I can pin here and I can do that. Today, because there's no ambient sound, it's very clear, I thought, let's do the webcam. But if I'm expecting a lot of noise around me, I'm better using a unidirectional, not omnidirectional. Right now, my mic is omnidirectional. If my son is speaking in the next room, you might be able to hear that. But for a unidirectional mic, it's going to go here and only you will hear that because the cutoff distance is about 6 feet. It will not catch the noise. And then video effects. For example, some webcams have inbuilt video effects, like you can minus the background or light enhancements, or it can follow your movement. There's a Logitech 920. If you install that, if you're moving, and if you set it up for a moving image, it'll actually follow the movement. It'll follow the movement. The camera is fixed, but the zoom will follow the movement. It's not the camera is moving, but the camera's zoom it'll zoom and then it'll expand and follow the movement. That I will show you in the next few lectures as well. So lens type, plastic or glass, I'll go for glass. Construction, you want a fixed base or rotating base, plastic or metal, cable length, that is important. If you want to use a desktop, you need a longer cable. Connectivity, I would prefer this, USB-C, because that's much faster, otherwise USB 3. That is the connection side of the webcam. Normally on the PC side, it is standard USB. I would not ask you to use wireless, they're not secure. Anybody can hack into it with some knowledge of computer. So this blue bar, when you see this blue bar in USB, that is a faster USB, USB 3. This is an older USB. There is 8 times difference of transmission speed from 2 to 3. And then from this, if your laptop has USB-C type 3, this is type A, this is type C. That is again 20 times faster than this. So if your laptop has, most of the laptops now coming, they have USB-C. If you have this, go for a webcam which is USB-C, and that is a very, you can, all the 4K webcams, for example, are USB-C. So this is advanced, but go for USB 3 webcam, at least with a blue bar in the USB connection. So and if you're worried that I may have no connection on my laptop or desktop, adapters are available. You can convert the 3 into 2 or as white type by using these very cheap economical adapters. You can convert the C into B or B into C anytime. These are available from any computer shop in most countries. So coming to webcam again, as I said, wide angle, narrow angle, I explained, fixed base and rotating base. Let's talk about this. This is a fixed base webcam. This is Logitech 920. This is a wide angle. This is a standard angle like you're seeing now. I'm using this camera right now. This is what I'm using. I'm going to be switching later on to this or its big brother 4K version. Or you can use a rotating base like this. This we use where we expect doctor to move a lot, physiotherapist. This can actually rotate right and left by a remote control. Microphone. Now, right now I'm not using a microphone, I'm using webcam. But if you plan to use a microphone, the considerations are either use a USB microphone or use a normal audio in microphone. Most people have this microphone. This is fine. You can just put that microphone in the audio in. But if you want to use a microphone with USB, that is far superior because it uses the sound card's direct capability. And then if you want to use a microphone much closer to you, then unidirectional microphone can be clipped on your shirt. Now, a lot of people ask this question, so I want to explain this. They say that how can we change our sound settings, mic settings? Okay, on the bottom right of your computer, you will see this icon. At the very bottom right of your computer, where the taskbar is. Click on this, you will get this bar, this box. On this box, choose the open sound settings, and you will see this box. Windows will open its sound settings. And then in the sound setting, if you drop down this, you can choose the right mic. There could be more than one mic attached to your system. And if your mic is not going, sound is not going through, the best thing is before you do telemedicine, check what microphone is ready now, defaulted on your system. So you can choose the microphone from here. Now, let me give you an example of how do you do it on the website. That was the Windows, but how do you do it on the website? On the website, you have this button, lock button. This is on all those telemedicine websites where there is software security like SSL certificate. And I think it should be compulsory for all telemedicine websites. If you click here, you will see that this website's camera settings open. Here, you can allow or disallow. You can click on allow. That means now the camera website will not block it. Sometimes your browser, even if your Windows has opened it, but patient still cannot hear your voice. So check from here, go back again. Check from here, click here, and see whether your camera and microphone are allowed. And you can check allow or blocked. You can even put ask. I've already allowed it, so it doesn't ask me every time. That means my patient will hear my voice whenever I go on telemedicine website of my choice. Go into the setting button, site settings, and see all the settings. If you ever have problems, you can make some settings like images always allowed, pop-up notices, because sometimes you have to allow this for the website to function, pop-up, microphone. So this is the way you can set up your telemedicine website so that you don't face problems even after the Windows has been set up. Even after you've done this part, but still patient cannot hear your voice, then they go to the website and change from the browsers. Speakers. I'm using this headphone just to prevent noise cancellation. At the moment, my microphone is noise cancelling, but I'm still using it as a precaution measure so that you don't hear. If you're speaking back to me, let's say if you're my patient in this telemedicine and you're speaking back to me, you will not hear your voice again. You will hear your voice back if my mic is not noise cancelling. That means my mic is not cancelling the voice, it's coming on the speakers. So the main thing I want to say is all these microphones have to be noise cancelling. And then the speakers, again, you can use a sound card speaker, which is USB, or you can use a single jack speaker, standard speakers. Now this single jack, most of the laptops now follow the mobile phone trends. In mobile phone, you don't have two jacks, you have one jack, both for speakers and microphone. So the laptops have started following it now. If the laptops has same, but you have one for microphone and one for speaker, you can use this connector, and then this can go into your new laptop which means that you can still use that single jack, but your old headphone and headphone and microphone can go in there, and then it can connect into your new laptop by using this adapter. This is very easily available. So USB light. Now the light is so important that if people cannot see you, they will lose interest. If it was very dark, imagine the difference it makes. Just take a look. I've just turned off some of the lights and I'm turning on some of the lights. It makes a huge difference. So it is dark, it goes bright, and person looks more visible. This is one setting where you can put light on the monitor. Light is, I'm going to talk about light a little bit more, so I'll leave that topic for quickly. And battery backup. Laptops have battery backups, no worries. But laptops battery can fail as well. So you can keep a second battery in case you want to do traveling and you're doing telemedicine from a different country. Mouse and pad. I think if you use a trackpad and you want to draw on the screen of an MRI scan to the patient, you may not be able to draw accurately. So better use mouse, even with a laptop, and use a mouse pad which has this support for the wrist. Portable drive. If you want to use a portable drive, USB drives people carry with them just to download the data, and use the blue one, this one. It's a USB 3, remember? Or USB-C, which is even better, faster. If your portable drive should have any of these connections, they're fine. I would prefer this, but if you don't have USB-C on your laptop or your desktop, this is the next best. So, internet, that is the oxygen now. Pay attention to this particular slide. The minimum I recommend download speed is 0.4 megabyte per second on your terminal. 1.0 is something you need. 1.5 is what you need minimum, but you could do with 0.5 with some compromise. I would prefer cable if you have option. Wi-Fi can go up and down depending on how far someone opens a microwave, someone, even with a car horn, we believe that there are some car horns, they can interfere with the sound of with the Wi-Fi. Now, how do you do a speed test? I think most of you would know speedtest.net. That website will take you through this. You need to know this part. How quickly you can connect to internet? What is your download speed on that computer? What is your upload on that computer? So internet speed is important. Now let's say if you're using this is a telemedicine session right now. First of all, you want to improve your internet speed. Make sure there is nobody downloading or uploading big files during your telemedicine clinic if your internet connection is shared. Like right now, I've asked my son not to play video games because I'm presenting to you. So he's not playing video games, and he will be eagerly waiting. Once I finish, he will start playing his video games. So ask your family not to use high download upload if you're using a shared connection, but it's better to have your own USB modem, and don't share the password at that time. Use your own USB modem. No online games. Close all of the websites, even Dropbox, Skype. Close all of them because they keep updating. Online drive online, Dropbox, Skype. Close all the files, all the programs. Charge your portable modem because if the battery is low, it will start flickering. Do the speed test at multiple places to find the best speed. Use LAN cable and invest in internet speed. It is the next oxygen. Believe me, it is. Now, let's talk about furniture. We are approaching now the closure of this session, but before we close and before we take up your questions, I want to show you your desktop. It should look like. You should be looking into this and that part. That is where your eyes should be. And your elbow angle should be not acute, should be more than 90 degrees. And your footrest should prevent hanging down with upside slide. And then your spine should be straight at the back like this. And you can see that this angle is important. This angle is so important. You can slouch, you can do whatever you like, but it's not smart way of using computer. If you're standing, then make sure still the angle is at least 90 or more. less will give you ulnar nerve traction over the long time. Professor Angus Wallace will probably endorse me as well on that. People, our secretaries, remember they used to have little finger numbness of ulnar nerve traction after a long time typing and bending elbows more than 90 degrees. And you can see that emphasis is this part, ergonomics of computer usage. I can see that what is missing here, there is no foot support. The tilt of the monitor is upwards. You can see that. It is like this, upwards. You can see that? It's not straight, it's upwards. So the eyes are dropping down, the monitor is looking up. Like this. That is important, that tilt. Don't do that. Let me make a big cross on that. So you remember, let's cross it multiple times. Don't do that. That is the way. That is a smart computer user. See that? See the gap? Can you see that gap? This gap. That is bad. Let's draw it again. This gap is going to give you a chronic disc prolapse very soon. And then over the years, you might see your leg is getting numb. Whereas this particular posture, and I would suggest a lumbar pillow here, will support you for a long time. And this is again a bad posture. That is a good posture. And try and put a lumbar pillow here. In hospitals, again, you can have different furnitures and they all should follow the same style. Now light again. Let's come to light before we close this lecture. Do you notice the difference? This looks like a horror movie and suddenly you become a kind of an Eid or Christmas event video. And that is where your eyes become dark and you look like sunken, sad person with shadows everywhere, arms, hair, and this is a brighter picture. Light should never be at your back. Should be on the front, like this, on the face, like this, 60 degree or 45 degree. I would prefer any one of at this range. The light should come, like right now, the light is coming from here. They are first falling on my face. And again, the distance is almost 16 inches. That is the recommended distance from the light, 16 inches minimum. So to get a good effect on the face, you should be positioned properly. Like, am I positioned properly? I'm just getting there. This is where I should be. I should have distance from each side, and the top as well a little bit. It's got a photographic rule of middle third. I'm there. I should not be sitting like this. Should not be sitting like that. Should not be sitting this way. I should be in the center like that. Okay. And make sure this distance is followed. And then make sure there's no moving background, like kids are playing at the background and you do telemedicine. I'm sure the patient will be more interested in how your kids are like and what's your home like. They will lose concentration on what you, so put a static background, maybe actually a branded background if you want to highlight your hospital or clinic. And then of course, people are playing, you can see they're playing there and the patient will be more interested, will he be able to catch what's going to happen in the background? So the patient will lose interest in what you're talking. Have a background, and if you want to put a color, this is the color which is recommended by photographers, professional. I think you see the pictures of the professional pictures of politicians, leaders, prime ministers. They use this color mostly. Now, the last slide on this one, your dress attire. Make sure when you're doing the telemedicine, you're very present-minded. Do not stand up because you may not be wearing a trouser, wearing a knickers. So make sure that telemedicine requires only this top part, well dressed. Whatever you're wearing below the desk screen doesn't matter. So do not stand up if you're not sure what to do. So guys, this is where I am. I'm gonna, before I take questions, before I involve Professor Wallace once again, I'm gonna thank Professor Javed Akram, the Vice Chancellor of University of Health Sciences, for letting us begin this course. Dr. Saqib Mahmood, who is the Controller of Examiners, has been working pretty much non-stop on this one. Dr. Saima Chaudhary, a very hard-working soul. She is helping me a lot. and Dr. Asad Zahir, again, an instrumental in this formulation of this course. Mr. Faisal Amin has worked non-stop with me for the last 3-4 days to set up the telemedicine, this portal of online delivery, MS Teams, and Zuhaib Aslam. I think he hasn't slept for the last 3 days. He has been answering your questions, a password, how to set a password. He's the admin of this webinar, this first lecture. I'm very much thankful to all of them. And Professor Angus Wallace, to you especially, you have come up with a wonderful support. I think today's lecture would never have been complete without you joining us today. So thank you very much, and I give it back to you, Professor.
Thanks very much, Suhail. It's a real honor to be involved with this new development. I have been really impressed with the way that Pakistan has developed their telemedicine platforms in a way that allows very, very good and modern management in this particularly difficult time in our medical lives. I do think, Suhail, we need to try and reduce the technical speak that you have been presenting. For me, it was a little bit over the top. I know why you have done it. I think it is very important for people to understand the equipment that is necessary, but actually I think that can be done by others as long as you understand the principles. I know, for instance, that nowadays it's much better to have a solid state memory in my laptop than it is the original hard drive disks, because they get clogged up. That sort of thing we need to know a little bit about, but only a little bit. And as far as the technical side of the computers and laptops are concerned, if you get a good laptop or a good desktop today, it will have everything that you talked about in it. You actually probably don't need to specify too much. I've just got a new Lenovo laptop. I've been really impressed with it. It's got solid state memory and it works beautifully.
Yeah, Prof, the idea was that people who are using their existing equipment and they haven't uploaded their equipment, and they want to know whether they can do telemedicine or that, and also to educate, because we're not going to be talking about technology. And the idea of me talking about is that I want to only talk about the relevant technology.
Yeah.
If I let the technologists do it, they will start going into the details, which we don't need.
Yeah. The beauty of a webinar like this is that it is recorded and people who attend can come back and look at the recording, and for the details are on the presentation. Yeah.
So if we can also, Professor, note that I have changed my camera now, and this is a wider angle camera. So if you're expecting a physiotherapist to show the movements, the neck movement, or the exercises, he can use the wide angle camera. And the details of this was important to be understood by the doctors who are using it, because a lot of them feel telemedicine is video conferencing only because of lack of knowledge. And the idea to show them the ability to expand telemedicine's horizon is only if they have knowledge. Their mind will not see what their eyes will not see what their mind doesn't know. So that is the idea of doing this technology talk. But I've tried to keep it very simple, and also I've showed some pictures about how to use the light, how to use a desktop, how to make sure your health is good, like your elbows are not too bent. And I'm sure that.
Yeah, I did like the bit where you described getting the position of your body, your head in the right place. I have learned, for instance, that I come over slightly better because my laptop is sitting on a box higher than normal, so that the camera is straight ahead of me and I'm looking at the camera instead of looking down. And that makes a bit of a difference to the way that you come over as the treating doctor.
Yeah, I've got a question, Professor, here.
Yeah.
There is a question from UHS 59. I'm not able to see the name, but the question is that about the high density, high definition pictures of pathology. Will there be any special requirement to see the pathology pictures on telemedicine software? Do you want to take it or shall I answer it?
I will give my response. You do need high definition pictures in order to study pathology. And when you're doing telepathology, you do have to consider that. Both telepathology and teleradiology are dependent on having very good quality images. And if you're working in these fields, you need to concentrate much more on the sort of monitor that you are using and the number of pixels that you are using on your monitor screen. Over to you.
I would address the different part of it, because when you're using telemedicine, this telepathology is for you to look at. So you can control your equipment, which means that you can have a 4K monitor. So you can, if someone is sending you pathology slides, better use a 4K monitor because that has the capability to go into details. Now, because it's your equipment and you can control it, you can't control patient's equipment. So yes, I would recommend that all the telepathologists to use the high definition, high pixel, 4K compatible monitors. They are the ones who can give you a good image. I've got another question. Future of telemedicine in Pakistan. How do you see that? From Dr. Ali Ijaz. Professor, with your permission, may I take this question?
Yes.
Future of telemedicine in Pakistan. Imagine that we just installed the telemedicine hotline at University of Health Sciences on the 19th of March. And we thought we have no time to educate people. But luckily, we did not need to educate people. People quickly understood that let's stay home, go on the website and see the doctor on telemedicine. Now, we did not even require to educate people because the interface was simple enough that people can see the doctor with few clicks. And that is where I suggest that telemedicine future in Pakistan is very much so that the two reasons. Right now, there are more than 4 crore, or that's got 4 crore people who use smartphones in Pakistan. Now, that is a huge penetration.
Yeah.
Into the country. It's a huge penetration. That means smartphones, apps, high definition cameras, more than 356 kilobyte upload and download. So there is a future of telemedicine in Pakistan. Doctors have learned it hard way due to corona epidemic. We have been necessitized to learn it. But by the way, Medical City Online has done more than 300,000 teleconsultations, and many of the vendors have done. So Professor, yes, what do you want to say?
I was going to butt in. You're quite right. The patient's ability to use the telemedicine platform has been outstandingly good. But equally, what I have been impressed with is the way that you and your team have managed to develop training in small groups for the doctors who are responsible for the telemedicine service. And I think the model that you have created, where you start off training half a dozen of your team in Pakistan, and they then go out and run tutorials themselves. And I've seen these tutorials. I am really impressed with the way that run out occurred and the enthusiasm of your team in doing it. But they've enjoyed doing it because they realized that they were providing an even better service if you had some training in using the telemedicine platform.
Thank you, Prof. I want to take a couple of more questions before we close. There's one question from Muhammad Haris Khan Badr. Muhammad Haris Khan is asking, is it possible to carry out telemedicine via mobile? I'll quickly answer this before I give it to Prof. Of course, it is possible to carry out telemedicine via mobile, but from the patient's perspective, I advise. From a doctor's perspective, there is so much instructions you want to give to patients. You're not doing video conferencing with the patient. You're doing telemedicine, and telemedicine requires at least 12 inches screen for a proper display of instructions. So I do not advise doctors to use mobile phone for telemedicine, but patients, yes. Either now, the websites, most of the websites should be mobile responsive, which means that if you run a website using a browser on a mobile phone, that should be mobile responsive. It will convert into a mobile format. If that is not possible, then there should be mobile apps available for that software. So yes, it is possible and not recommended for doctor, but for the patients, yes. Over to you, Prof.
I agree. I think that if you are the doctor carrying out a telemedicine consultation, you should do it with either a laptop or a desktop and not with a mobile phone. I do think that most patients are already very well acquainted with their mobile phone and they use it exceptionally well. They do not need a laptop or desktop. It is slightly better if they have it, but not essential. But I think the doctor does. And the ideal system is to have your telemedicine platform adjacent to any electronic health record, so that you can actually have the electronic health record either on your laptop that you can switch to during the consultation, but actually better to have it on a second screen so that you can use the electronic health record and transfer information to the electronic health record once you finish the consultation.
Prof, I would beg to differ with you on this one, but it's good that we discussed that thoroughly. The modern telemedicine softwares incorporate EMR within. You do not need a second software. And this is the whole idea of the thing, that we want to make one code. But in certain situations where the existing NHS or other systems do not allow, then yes, you can keep that record on one screen, as we discussed the other day for a hospital in London. I remember you're referring to that conversation, that we can open the hospital record, which do not allow for us to take away, but we can open the telemedicine consultation consortium or software on one side, and then we can send the record of that encounter back to the mainframe through a PDF file. That we can do.
I just think personally it's easier having two screens so that you can actually have the health record on one, you can have the patient in front of you on the other. I think it makes it slightly easier for the consultation. Maybe my slightly older brain is finding it slightly too difficult sometimes.
Yeah, but Prof, I really appreciate that you're talking about telemedicine in a different way, but I believe that the modern softwares do not require a second platform, and I will demonstrate that as we go through the lectures. I want to take one more question before we close. The last question for today, it is from Muhammad Farrukh, and he's asking, what should dental students or dentists do about telemedicine? And I want to really take this question because it's a big area. Let me show you your device. This is a telemedicine device for teledentistry. This is a wireless intraoral camera. This can be connected to the software, and I will actually demo that in my next lectures. How can you connect this into a telemedicine software? And then this can go into the mouth, and the oral hygienist sitting in Gujranwala, for example, in some other city, can be connecting the patient to the city dentist. So an oral, yes, Prof. So an oral hygienist can be your conduit, can be your coordinator to a teledentistry. All he needs is an intraoral camera and a suitable software which can accommodate that. So yes, teledentistry is coming. We have a complete module, and Dr. Humayun Taimur Beg, he is in charge of teledentistry. He will be giving a talk on that as well. Also on telephysiotherapy as well. Dr. Junaid Haris Hassan will also come and do that. Prof, you want to take a last one on this one?
Just a little bit of slight concern. Nowadays, because we have such excellent x-rays of our fixations in orthopedics, The lawyers love to get hold of x-rays where perhaps the screw's not in the right position or you've got a broken screw. Just a word of caution, if you are taking pictures of the teeth inside the mouth, you might just beware that lawyers might get involved at some stage.
Yeah, that's possible that people can be nosy into your records, but patient can delete medical records anytime they like. So on this note, I want to say everybody that thank you very much for joining. Thank you very much for being with us. You're going to be here tomorrow as well, same time, and we'll be taking you into a different mode of telemedicine. Today was the introduction. Professor Angus Wallace has been with us today. He will be joining back on, and I think this is the third weekend. He will be doing his own talk, full talk. So again, thank you very much, everybody. I know people have joined from Mauritius, from Kenya, of course, Pakistan, the majority of them, and then England. Dr. Saima Niaz and her group of psychiatrists have joined us, and then from India as well, I can see, and then there's some other people from Bangladesh, I think, as well. Also from America, people have joined. So thank you very much, everybody. I really appreciate, and we hope to see you soon. Thank you. Bye-bye.
Thank you very much. I thoroughly enjoyed joining you. Good night.
Good night.